have you treated particularly, or do you know of other Rolfers who then work with people struggling with depression or anxiety?
So that's a great question. Rolfing, we're working with the entire body. Ida Rolf was not particularly interested in helping like CrossFitters with their shoulders, right? Like she wanted
Didn't exist back then.
I know. I mean, like she wanted to help like human beings. She saw this as like helping human beings evolve to their maximum potential.
Mm-hmm.
Like developmentally, like kids are developing, and like when you go from just laying around to crawling to walking, like these are like big steps in the development of a human being. And Ida Rolf saw Rolfing as a way to kind of interact with the body, with the emotions, with the psyche, with everything. So someone asked her, like, why do you work on the body? And her answer was, I can put my hands on it, right? As opposed to like someone a psychoanalyst, right, who's just
Right.
dealing with like nebulous like talk structures. So when it comes to something like depression or emotional issues, again, like my sense is that a lot of these are like, they're all body things, like they're all in this body. Like if I'm depressed, it's not the room that's depressed, it's in this body, right? Whether it's a chemical issue or it's ingrained, something that I picked up, from the household that I grew up in, or a situation that I was exposed to, whether it was a long-term trauma or isolated event, it's something that's in this body.
Mm-hmm.
In this body is going to be in the tissues somehow.
Yeah. When you said, integrated versus disintegrated, that's when I started thinking about with people dealing with depression, anxiety, emotional issues, because that you are you're not integrated fully. You're not functioning as you would want to, as a, optimal human being functions.
Yeah.
So
I think posturally, haven't they shown, or I don't know if you know, but like, I thought there was like studies that show like, okay, if you've got this posture, you're going to, a rounded posture, you're going to feel more depressed versus upright. And then there's like, if you put a pencil between your teeth to fake a smile, that you actually are in a better mood. Things like that. So
yeah,
definitely.
You nailed it. I was going to mention that pencil in the teeth thing. Certainly when it comes, the way that we feel inside is going to show up on our bodies externally, right? So if you see someone and they're really closed down, they're hunched, they're rolled forward, they're arms crossed, protective, it's different than someone who is willing to take up a lot of space, willing to move around,
and vice versa, right? Like the posture of the body, if you're habitually like that, it's going to create that emotion more.
Yeah, you can. Yeah.